Time to log into Gavaya. I'm from the Australian Digital Health Agency's Education and Adoption team. And today I will also be joined by Fane, the Implementation and Training Manager from Zedmed. And today's session is going to be an overview of My Health Record, particularly for specialists who are using Zedmed software. Thank you so much, everyone, for joining us. Before I do begin, I would like to acknowledge the traditional owners of country throughout Australia in their continuing connection to land, sea, and community. I pay my respects to them and their cultures and to elders, both past and present. So Zedmed's new release has some very exciting new My Health Record functionality that is being made available, especially for those of you who might be specialists or working in specialist practices. There's some new features that would be of particular use to you. And before I hand over to the Zedmed team to do the demonstration, we're just going to give those of you on the line today a little bit of a background to what actually is My Health Record. So some of you may have heard about it before. You may have occasionally had a look at some documents in there, but we understand there may be still some of you that are fairly new to using My Health Record. So the first part of the presentation is going to be a bit of an overview for you. So I'll run through some key information that you will be able to find in a patient's My Health Record. We'll talk about the benefits of using it to provide better health outcomes for your patients, and overall the benefits for your practices that are using My Health Record as well. I'm going to explain when can you access and what it means to be appropriately accessing the My Health Record of your patients. And I'll also briefly outline the registration process for those practices that might be on the line that are interested in registering for My Health Record and would just like a bit more information if you're not already registered. I'll give you a brief overview and also explain how the agency can offer you some support and assistance with that process if you need it. And then, of course, we'll have our Zedmed demonstration where you'll get to see what is the new functionality, what are some of the new functions that you can use within Zedmed, and also they will explain their support and assistance that they can provide as well. Now, at the end of the session, we'll also hopefully have some time for Q&A. So on the right-hand side in the toolbar, those of you who are listening today, you should have a chat pane. So in there, you can post your questions and I'll have a look at them towards the end of the session. We'll read out what's been asked and we'll try to respond to you live in the session. So definitely don't be shy. Helps everyone to have questions responded to. So if anything comes to mind, if anything is unclear, then please do pop a message into the chat and we'll definitely be happy to cover it towards the end of the session. So what is My Health Record? As I said, for some of you, you may not be super familiar with using it. So basically what it is an online summary of an individual's key health information. It's a way for healthcare practitioners to add information about their patients to an online sort of platform where that information can then be accessed by other healthcare providers that might be looking after that patient or the patient themselves. So the My Health Record system is actually personally controlled. It's the patient's own record and they control who gets to view their information, what gets uploaded or added to their record, what types of information are uploaded into their My Health Record, and they can control what information stays in their record as well. So it's completely personally controlled, but being an online summary of their health information, it gives an opportunity to the patient to access that information when they need it. Their representatives, family members, if they've provided access to that record, they can view their health information. But of course, very important also to remember that other healthcare providers can access that information, which is very useful for patients that do end up traveling between different healthcare providers. They might be seen by lots of different healthcare providers, and all those people need access to information. So it's an easy platform for all of that to be sort of stored in one place. And it is part of a national system. It's available all across Australia and accessible at all times. So in those situations where it's hard to get track of information out of hours on weekends and public holidays, or when people are traveling interstate, they may be seeing different healthcare providers, the My Health Record is a great solution because it does provide people with access to information when they need it. And it is also very strictly protected. So it's protected by a lot of cybersecurity sort of protocols and also legislation. Things like the My Health Records Act, Privacy Act, all protect the information that is stored within the My Health Record system. So that's just a bit of a overview for those of you who are fairly new to using My Health Record and are thinking about starting to use it more often in your practices. So if we have a look at some information about how different healthcare providers and settings are using My Health Record at the moment, these statistics are from December last year. And we can demonstrate to you that there are most community pharmacies that are already connected to the My Health Record system. They're viewing information. They're able to upload information to the My Health Record system, such as, for example, dispensing records. Then we also have majority of general practices. We know a lot of them are registered with My Health Records. They're accessing it, viewing it, uploading very useful documents into patients' My Health Records as well. One of those documents would be things like a shared health summary, for example. Very important document that is available in a patient's My Health Record if they're GP, for example, has uploaded it. So we know a lot of them are connected and using the system already. We have majority of public hospitals across Australia having access to My Health Record, uploading documents as well. And what we want to see is our sort of specialist sector as well having access to this really important information. So that is why we're working with software vendors to continue to improve the functionality that's available to you so that you can also access this information when you need it for your patients, and so that you have an opportunity to contribute to their My Health Record as well, so that you have the ability to upload information into their record so that it can then be viewed and taken into sort of consideration by other providers that might also be looking after your patients. So what is inside the My Health Record system? Now we have lots of documents that are uploaded. There's a couple of different categories of documents that are available. We have clinical documents, so those that are uploaded by clinicians or clinical settings, laboratories, pathology laboratories, for example, diagnostic imaging providers. We have specific medicine documents, information that's uploaded by those who dispense medicines to patients, so community pharmacies, for example, and prescribers that actually issue them with new prescriptions. So all of that information can also be found in My Health Record. We also have quite a few consumer documents. So I said earlier that the My Health Record system is a patient-controlled kind of environment, and they have an option also to add their own information, their own documents to their My Health Records. There's also some documents in there that are uploaded by the consumer or the patient themselves. So that kind of gives you a bit of an idea, and we have more than 500,000 documents that have already been uploaded. So there's certainly quite a lot of information in the My Health record for you to find for your patients. Now, this also gives you a summary of all the different types of documents that are available and can be found in the My Health record system. So if you were to have a look at a patient's My Health record, you could find some of those documents in there. As I said, there's a couple of different categories. So consumer documents are information that consumers add. They might contribute information like their own health summary or allergies, for example, or their emergency contact information. That's something that they can add. We also have another category of information that is uploaded by Medicare. So usually by default, Medicare will upload information about a patient whenever they have processed a type of a claim, for example, could be MBS, DVA items, PBS claiming through pharmacies. That information will link up with the patient's My Health record and will be visible in there. Also, Medicare looks after the Australian Organ Donor Register and the Australian Immunization Register. So information in those registers flows through into the patient's My Health record generally by default as well. We then, of course, do have those specific healthcare provider documents that can be uploaded by healthcare providers or by healthcare organizations. So say discharge summary would be uploaded by the hospital, pathology, diagnostic imaging reports, or specific documents like a pharmacist shared medicines list would be specifically uploaded by a pharmacist. And then we have other very useful documents for you to look at, such as shared health summaries, for example, which would give you that overall picture about a patient if they were potentially referred to you and that information wasn't provided. You could get extra information from looking at the patient's My Health record if they had those sorts of documents uploaded. It may sound a little bit overwhelming that there's a lot of information and a lot of documents in the system, and you may think, I'm never going to have time to look at all of this information. But for that particular reason, we also have specific views available. We'll demonstrate some of them in Zedmed later, but basically they collate information from different types of documents, and they just pull out the relevant information and put it for you in the one view so that it's easy for you to find, to digest and process. So if you were looking specifically for, the patient's medicines list, what are their medicines, what are they taking regularly, you could have a look at the medicines information view and it will extract relevant information for you and show it to you. Also with pathology or diagnostic imaging, you don't have to look at sort of separate documents or try to find them. There's actually quite easy to navigate views available, which present you with a summary of the tests that have been uploaded or done on the patient, and you can select the one you need to review during the consultation, for example. So this is an overview of all the information that is available. I thought I would also step you through just a couple of screenshots before we do get into the demonstration a bit later on, but just so that you get a bit of a taste for what you can find. So as an example, this is the medicines view, one of those views that collates information from different documents. So on the left-hand side, you can see a summary of different documents that can include medicines information. So the view will kind of pull out the data from those documents, as you can see in this example here, and it will tell you where that information has come from as well. So on the left-hand side, you'll see the name of the document it's been sort of extracted from. You can always click on those documents on the hyperlinks and open them up and look at them in full if you need to. Otherwise, if you get the information you were after from just the view, then that's fantastic, and hopefully that answers some of the questions for you. this is a really useful view to have a look at if medicines information is something you're looking for your patient. If you need a bit more sort of background for them, and you haven't been provided with sufficient information maybe before the consultation, you'd like to kind of review that, the medicines area is a great place to start. As part of the medicines view, there's also a couple of tabs that you can click on that take you to the relevant sections of the view. For example, we also have an allergies and adverse reactions tab, and you can click on that and it will take you to the relevant section. Just wanted to demonstrate as well here, you can see in this example, the patient has had an allergy added by a healthcare professional. We can see on the left-hand side, it tells us that it was an event summary that was uploaded for this patient. Again, we don't have to look at the document in full and read all the information that was included there, but if we just wanted to know what allergies have been recorded for this patient, you can clearly see that here as soon as you open the view. You can also see how information could be presented if it was patient entered. So if the patient themselves has added information, you can clearly see that to help you decide, where's the information coming from, so it's always clear to you who has uploaded what pieces of information. But that's an example of the allergies and adverse reactions section. You can also get to other documents through this navigation panel, but in the demonstration, I'm sure we'll show you how to get to the relevant areas in Zedmed and find information very quickly. In terms of pathology reports, we have been working with a lot of private pathology providers all across Australia, and there's a lot of them now that are able to upload information to My Health Record. There is information available on our website, digitalhealth.gov.au. You can actually have a look at all pathology providers that have the ability to upload pathology test results to the My Health Record system. And you can see perhaps whether the lab that you refer patients to is able to upload their test results. But if the patient has been visiting those labs, or if they have been in the public system, a lot of the time they are able to upload pathology reports. Under the pathology review, you can find them all there. So again, that can save you a lot of time. You don't have to go looking for other bits of information. You don't have to contact the lab or the patient's regular GP to try and get a copy of the test results if they didn't come through to you with the referral, for example. You can hopefully find all of that information in there, and that can help you decide if further testing is needed, or you can see how recent the tests were, because you get all the information here about what type of test was done, where was it done, when, and you can click on the report links and that will open up usually a PDF for you, and you can actually have a look at those test results. There is also a new view that was added to the My Health Record system last year. It's called the Immunization Consolidated view. In response to the COVID pandemic, it was a new view that was added to the system to provide you access to that important immunization information. So the data comes through usually from the Australian Immunisation Register, but there can also be other documents that can be added to a patient's My Health Record that can also include immunisation information. So those documents would be things like a shared health summary or an event summary, and this view will consolidate all of that information in the one place, and you will clearly be able to see when has the patient had, what vaccinations, what were they for, what type of dose they had. It even has things like their immunisation status, or the COVID-19 immunisation status, if they're up to date or not. Their due date for next lots of vaccinations are all available in this immunization view, and it's something new that has been added to the system. You're probably somewhat familiar with receiving a hospital discharge summary, but again, sometimes there can be delays with getting your hands on this information. It might go to the wrong practice. It may be missed with the referral. You may not have gotten a copy, and the My Health Record system is a great place for you to look in the first instance to see if you can find it in there, because a lot of public hospitals, quite a few private hospitals now also able to upload discharge summaries to the patient's My Health record. So you can go in there and very quickly access this information, get a copy of the document, and you'll know straight away what has happened during their hospital stay, what kind of follow-up is required, what changes were made to their treatment, and so forth. So and usually these types of documents are uploaded by default, so there's not usually any sort of extra steps that have to take place. Quite a lot of the time, things like a discharge summary will just automatically be uploaded to the patient's My Health record when they're discharged from hospital. So you can usually access that information fairly quickly. So if we have a look at the benefits of using My Health record, of course, having quick and easy access to health information is the main benefit of My Health record. When you haven't been provided with information directly, if it hasn't been sent through to you, if you are preparing for a consultation with a patient, they haven't come in yet, and you're trying to get more information so you're prepared, you can quite quickly, easily access that key health information through the My Health record system, or even a discharge summary or a pathology report that you would have to make multiple other phone calls to try and get. You can usually much easier access that information through the My Health record system. There's less administrative burden on your practice to gather all of that patient information. It saves you time and cost in terms of then sending information to other healthcare providers. So we'll definitely demonstrate very shortly how you can contribute to the My Health record system of your patients. What is it that you can upload? As an example, the specialist letter. We'll definitely make sure we demonstrate that to you, but it will save you time and cost not having to send a copy of that information to lots of different healthcare providers. If a copy of it is just uploaded to My Health record, then they can access it from there. So that's a really big bonus with the My Health record system. It does improve your clinical decision making because you have access to patient-specific information that otherwise maybe wouldn't have been available to you. So you'll have more information. You can be more informed about making clinical decisions for your patient. But certainly in terms of testing, scans, it does save a lot of time to your practice having to chase up different test results, and also just avoids having to send the patient for duplicate testing when they may have already had that test done recently. So that's an overall sort of overview of the benefits of using My Health record in your practices. Now, a very common question that we do get asked also is when can you access a patient's My Health record? Do you have to ask them for permission? And for healthcare providers that work in health organizations, if your organization is registered with My Health record and they have given you as a healthcare provider access to the My Health record system, and provided that you're accessing it for a legitimate reason, which would be providing care to the patient, providing healthcare services to them, then under the My Health Records Act, you have authority to view their record and to upload information to their system. So you don't have to ask for permission. You're already authorized to view information. You can also upload documents to their record as well, which is why a lot of the time quite a bit of information gets uploaded to patients' My Health records by default, and that's completely fine because we do have that legislation in place. People can protect access to their records though. There's a couple of patient controls as well. So people can restrict access to their whole record or to a specific document, and they would place an access code to their record, and it's completely up to the patient to then provide their clinician with that code so that they can see that information, or if the patient's not comfortable with that, then it's up to them and they can choose not to provide you with access. Because, as I said, it is a personally controlled environment. But for majority of the patients out there, we have, I think at this point, 9 in 10 Australians have a My Health record, which is more than 20 million people. The number of people who have restrictions on their record is in the thousands. So it's not a lot of people that have placed those restrictions, but they're there for people who want to use them. They can also set notifications, SMSs or emails if they want to be notified when someone new has accessed their record. And there is also a option for clinicians to access a record in case of an emergency, but there is more information available on our website and the OAIC website about using the emergency access function appropriately. So definitely make sure all of your staff in your organization are appropriately trained on how to access the system and how to use the system. But today we are here to demonstrate to you what does it look like, and you know, how do you perform certain functions. For those of you who are not registered yet with the My Health Record system, this is an overview of the process, but I will let you know that we, as the agency, offer a lot of support to practices who are interested in registering and to specialists who want to register their organizations, for example. So first step is for the individual who wants to register the organization to make their PROTA account. They will then access HPOS, and through that platform they will complete certain steps and will then register their organization with the healthcare identifiers service, and then they will be able to set up access through Zedmed software for My Health records. But as I said, for those of you who are interested in connecting, we do have a dedicated team in the agency that can take you through this whole process so that it's very simple and easy for you. And we have provided their details here, so you're definitely very welcome to reach out. You can also contact Zedmed for more information and support. A lot of PHNs are also doing work with contacting specialists and offering registration support. So there's definitely a lot of us out there that can help you through this process, and we want to see as many of you making the most of being able to access this really important, useful health information about your patients through this system, and we're here to support you with connecting so that process is very easy for you. In terms of resources, if you are wanting a more in-depth training session, we definitely can offer that. We have access to a bit of a training environment, and we can demonstrate to you how to perform certain functions, and can also provide you with more background about the My Health Record system. So when you get a copy of the slides, there's links for sessions you can join. If you don't need a really in-depth session, we also offer shorter 30-minute Q&A sessions. You can come in, ask your question, and they're very sort of simple sessions for you to log on to. And we also do offer more training specifically for specialists on the My Health Record system. As well as our e-learning modules. We have step-by-step instructions available on our website, which is digitalhealth.gov.au. We've got a dedicated page for specialists. We have instructional sort of materials for you to follow if you are wanting sort of step-by-step instructions for performing certain functions in your software. But for now, I will pause and I will hand over to Fane to take us through the demonstration, if that's okay.
Thank you, Jenny. Awesome. Now I'm just going to share my screen first. Share my whole screen. Okay, so what I'll take you through today, I'm just going to cover the setup in Zedmed, what you need and what's required in Zedmed, and I'll cover also the clinical side of Zedmed, how you can view, how you can write specialist letter there, and how you can view My Health Record summary inside the patient file. So the first thing first, and also I'd like to mention, we will send out a link to our online resources, which we've updated with all the required steps to help you through this. And if you'd like a walkthrough, we will publish a recording of this. And also we constantly run My Health Record webinar. We will run a webinar for My Health Record specifically for our Zedmed clients. In terms of a setup, I think that the biggest one is you've got to have a NASH. It's required that you must have a NASH certificate installed. Now, for most of our practices, to tick off this requirement, the easiest one I can think of is if your doctor's currently prescribing electronically, then that means you're already set up for most of this. So when the NASH is installed in your Zedmed, under management and practice setup, you'll see a HPIO number that's already been assigned here. So again, if you're using e-prescribing, most of this are already in your system. So there's a practice level setup with your NASH. The treating doctor or the specialist will also need to be set up with their HPII, and that's already here. So practice setup, treating doctor setup, and inside a patient record, you'll find on the left-hand side, you'll see an eHealth icon there. If it's currently X, it just means their IHI hasn't been loaded into Zedmed. There are specific settings that we enable to do a bulk lookup of patients' IHI. So that's something we can assist you with, and we've documented that in our online resources. So 3 requirements, HPIO for practice, HPII for the doctor, and IHI for the patient. So those are must have before you can actually view My Health Record or upload My Health Record or write letter to My Health Record in Zedmed Clinical. I've got a test patient open in Zedmed Clinical. I'm just going to head over there and just in addition to what Jenny has covered earlier, I will show you what it looks like, how you can view those records in Zedmed. And as part of the setup, if you've got your HPIO, HPII, IHI loaded, the next part of the requirements to be able to write the specialist letter is that in the address book, I'm just going to click yes to bring up a contact. So in the address book, where you enter the specialist or the GP details, the following must be loaded as well. So you must have the referrer doctor's HPII entered and the practice HPIO, so the practice at where the GP is working as an example. So that must be in your address book, or the specialist to be able to write a specialist letter and upload it to My Health Record. So those are the setup requirements that you need to have in Zedmed to be able to write the letters. And don't forget in Zedmed, these numbers are quite long, as you can see, right? So you can use Zedmed where it says search HI here. You can actually use Zedmed to locate those HPII number for you. So you can go in and do a search. It'll use the details that you enter in Zedmed to go and locate the doctor's HPII, and that'll be populated, and you'll be able to save it into the address book. So coming up in our next version, what you'll see, I'm just going to stop this and I'll come back to it. There are some additional functions that were built into Zedmed. I'm going to purposely bring up this window here. What you can see in Zedmed, inside the patient record, are records that have already been uploaded to My Health, and that's including descriptions, any letters, and allergies and so forth. And you'll notice when you get this version is that there's a button up the top. It's for Include My HR. So because I've clicked on that before, if I don't click on that, it's going to show me just what the specialist has entered into the patient record in your practice. But if I want the records from My Health Record to populate as well, I can simply click here, and then that's going to populate, and they can have a quick view, and they can always click back to the button up the top for it to go away, so you can just view your notes. On the left-hand side, where we have summary views, we've got immunization records. There is now a new button here to include My HR. So not only you can view it inside here where you see the consultations, you also have the ability to view it on the left-hand side. I'm just going to go into this patient. Yeah, also have the ability to view it on the left-hand side. Medications here as well. There's a button here for My HR or My Health Record. If I click on that, it'll show me just the medications that's been prescribed in this clinic. And if I want to view everything, I simply just click on this icon to bring up all the other list as well. And same goes to immunizations, allergies, where you see include my MHR, that's where those informations will come up. Whereas then if I go into the problem tabs, you can see it's not there. So you'll find them, any results will populate under the results tab as well. So that's really, that's very helpful in terms of viewing records that's been uploaded. And there are various ways if you want to have a look at what's been uploaded so far, instead of going into each tabs or going through this list. We've got a new icon here. It says, this is for provides My Health Record information. If I click into this one, this is how you can view the record that's been uploaded. So on the left-hand side, it'll take defaults to 2 years. So I've got it set to 2020. And then you can kind of tick off, you can filter it. If you just want to view letters uploaded by specialists, you can do so, or look at discharge summary, for example. Otherwise, you can view all. I'm going to hit refresh on the bottom here, because that way Zedmed will then download the records from online. So shortly it will come up, and this is what it looks like. So I've got a shared health summary. If I want to have a look at this record, I can simply highlight it, and there's a view document. It'll do a preview of the document. You can view the document, you can save it to the patient file. So what I can see here is that there was allergies added, uploaded, sorry, and there's also medications. So this is the type of information you see. You will also see who uploaded the information. So you've got the patient demographics as well attached to the document. Same thing if you want to look at specialist letter. So once a specialist upload a letter, you can view it from here. Again, you've got a preview, or you can go and view the document. I view the document now. So this is what in terms of the document format, this is what it's going to look like. So you've got, this is the patient details here. You've got the location, which I just got it as branch 1. You've got the author. So author account will be the person who wrote the letter. The details is where the body of the letter will be. So this is the free text where the specialist will be writing the letter, and then it'll attach the following information as well. So you can choose to print this. Otherwise, you can save the document. It's down the bottom left-hand side. You can actually save it to the patient record. So I'm just going to close this. And if I minimize this, again, Jenny mentioned the pathology. There's diagnostic imaging here as well, where you can view, if it's been uploaded on their end, you will be able to view it here from here as well. So I'm just going to close that. And if you would like to upload my health record, on the left-hand side under quick documents, you've got my health record summaries, shared health, and I'll just take you through here just to give you an understanding of what's actually been uploaded. So in this document, what's coming across from the patient record, it'll bring the allergies, medications, and there's a box here. If there are medications that you would like to not include in this upload, you can, it's a simple untick, you just untick it. You've got any list of any diagnosis recorded under the patient record, and also immunizations down the bottom here. So this page basically automatically pulls the information. You just need to review it, tick or untick anything that you don't want to, or the patient don't want to be uploaded. And if I click next, it'll simply ask you, there'll be a button to confirm and then upload. So that's uploading my health record here, and this is viewing my health record. Now I want to show you the specialist letter and what it looks like. So in terms of writing a letter to upload it, you have to go to referrals. Now, just quickly, if your specialist is currently using the batch writer or quick documents on the left-hand side to write letters for patients, this will not be uploaded to my health record. You will have to change the way you write your letters, and you go into referrals. What you'll now see, there's a tab here where it says specialist letter. And then you address it to the doctor. Just going to double click. So once you address it to the doctor that we've set up with the HPII and stuff, and then you click on write letter, that'll bring up the specialist letter format. So if I am to click on it, it will load with a format that looks exactly like this letter, and where the specialist can write the body of the letter here, and they'll simply click upload, and that'll be uploaded to my health record. So that's easy. So far, we have clinics who are currently piloting my specialist letters, and we've received some really good feedback, positive feedback around the fact that they can view what's been uploaded already. So I think that covers it. And again, we will send out our communications and attach our knowledge base for you to refer to. for you to refer to. So that'll be this one here. And yeah. So Jenny, anything else you wanted to check on my end?
That looks great. Thank you, Fanny, for the demonstration. There haven't been too many questions coming through, so everybody who is on the line, if there's anything in particular you'd like to see, let us know, or any other sort of questions, definitely pop them into the chat pane on the right hand side. I just wanted to ask you a question. With the uploading of a specialist letter, does any of the information sort of get pulled in from the clinical file of the patient when the letter is created, or does it have to be entered in by the specialist?
I'm just going to bring up the letter so we can have a look. So the details down here, so it's got the patient names and the, but that's basically it that comes up.
Okay, so it's a little bit different to the shared health summary, for example. With the shared health summary, the information comes through from the clinical file and you can use the tick boxes to include information. And here you add it, yeah?
That's correct, yeah. This is just for writing letters, and if they want to add, if they want to add allergies and add the medications and stuff, they'll have to upload it.
Okay, perfect, thank you. And if they did want to upload an allergy, what is the best way to do that?
So there is a settings in Zedmed that I probably should have touched on earlier. There is a settings in Zedmed where it can go and do an auto upload after the auto upload of the medications. So the medications can be auto uploaded to my health record if it's switched on. In terms of allergies, you'll have, if you want to upload it, you have to go on the left-hand side here and upload it under the shared health summary.
Yeah, or an event summary as well. With the shared health summary, you do have to upload the document in full, so you have to make sure that you include information in all of the 4 sections of the document. So you always need to include the patient's current medical conditions, their current medications that they're known to be taking at that point in time, because that's what the document is designed for. And when other clinicians are looking at that document, they're treating it as, you know, the health snapshot of the patient. So for those of you who might be uploading shared health summaries, make sure you do cover all of those sections. An event summary is probably a better document to upload if you're just wanting to record, you know, one particular event or piece of information, such as a new allergy that's been, you know, recorded. But thank you very much for showing that to us. I also wanted to ask what would be the easiest way to get to a discharge summary? How would we find a discharge summary?
Yeah, so in clinical, just above summary views, where you've got the second icon, provides my health records information. So if you click into this and refresh, just to populate with the records, it should come up shortly. Oh, sorry, this is viewing what's been uploaded by the hospital.
Yeah, that's right, yeah. So if there was a discharge summary, it would appear in this window.
It'll come up here. I think I've got it on my next patient. So sorry, it's just loading. It will come up with one of the options where you can expand on the left side.
And there's also a couple of controls on the left-hand side I can see as well in terms of filtering. So if you're looking for information within a particular period of time, you can play around with the filter settings on the left-hand side, or if you're finding that something's not appearing in the list, but you think it really should be there, then maybe on the left-hand side, one of your filters is, switched on, as an example. So that's, good to see.
Yeah.
Perfect.
So it'll be listed under here as a discharge summary.
Yeah, that's right. And the medicines view, I can see there's one available for this patient. So again, is that an easier way to navigate, or do you recommend the tab over there?
I think the tab is it's a very handy feature in Zedmed, because if you want to see everything, you simply just click on this icon and it'll display it. And if you click on it again, it hides it. So
that's right.
Instead of
So that would be a summary of sort of different types of medications that have been recorded in the record. Say if something was dispensed for the patient or prescribed to them, you can see them over there. For any clinicians that are wanting to see a summary of allergies, for example, for the patient, though, then they would find them there. Or if you were to have a look at the medicines view, then there would be sort of that reddish pink sort of area where you can find that information. Is that right?
Mm-hmm. Yes, that's right.
Perfect. Well, it really doesn't look like there's any questions from anyone in the audience, which hopefully means that we've covered everything off very well. But I hope this gives everyone a bit of a taste of what are some of the new additions in Zedmed. You can see that a lot of information can now be displayed in the software for you straight away. You may not have to specifically go into someone's record. It's already pre-filled sort of in the clinical record of your patient. You can see if new information was added, and you can then decide if it's worth having a look at that information in more detail, which I think is really great to see. And also important to remember that if your specialist is wanting to upload a letter to the patient's My Health record, that means other practitioners will have access to that information. If a patient goes into a hospital, or they go back to their general practitioner, for example, or are seen by other healthcare providers, they want that information in their My Health record. So it's important to remember that this functionality is now available to you. It may involve a tiny change in practice in terms of how you create that letter, but hopefully it's not sort of very significant, and really does just mean that you're now able to contribute to My Health record, and that information is available to the patient and their other clinicians that might be looking after them. There's a question from the audience about when will Zedmed update be released? Is that something you can respond to?
Yep. Sorry, very good question. Yes, so this will come out together with the our next version.
Yes, it comes out with
version 35, and that's together with the Medicare Web Services upgrade. So our very next version 35, and that's coming very soon.
We'll communicate.
Yes, and communications will be sent out to clients once with that release.
Fantastic. Thank you very much. I think we can probably finish the session here, but I'm sure if there's any questions at all, definitely reach out to the Zedmed team or even the agency. As I said, we have a dedicated specialist connections team that can answer any questions that you might have about your practice using My Health record. If you need any training for your particular practice, we're happy to organize some sessions, but certainly if you're new to My Health record and you need some support with registering, we can take you through that step by step. So feel free to reach out we're here to support you, and hopefully you'll start sort of using My Health Record a bit more routinely as part of your healthcare delivery in your practices. So thank you so much, everyone, for dialing in, and thank you, Fane, for taking us through the demo.
Most welcome. Thanks, Jenny.
Thank you so much. Bye, everyone.
Bye.